Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Pallavi Garg, gastroenterologist at the Cure Clinic, New Delhi, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Hello everyone, I'm Dr. Pallavi Garg. I'm gastroenterologist and hepatologist practicing at Max Super Speciality Hospital, Saket, New Delhi. I'm also the director of the Cure Clinic, Narayana Vihar, New Delhi.
So, doctor, question for you is, what exactly is IBS? And how would you describe it in simple terms?
IBS, or irritable bowel syndrome. This is the problem of the intestine. Yes, structurally the intestines are normal, but there's a problem in the function. There's a miscommunication between the gut and the brain, which sometimes can lead to change in the gut movement, change in the pain perception by the intestines, the perceptions given by the brain, and change in the bacterial balance of the gut, the balance of the good and the bad bacteria. So basically, it's a miscommunication. The gut becomes hyperexcited, more sensitive, oversensitive to some food, to some emotions or some stress. And then it can lead to symptoms in the form of pain in the abdomen, increased bloating, change in the form or the bowel habits, like some patients can have diarrhea, some can...
What simple screening questions can a consulting physician ask to suspect IBS?
I usually start my screening by taking history from the patient in the form of, are they experiencing recurrent abdominal pain for last several months? Is there a sudden change in the bowel habit in the form of frequency or change in the bowel habit, like somebody experiencing loose motions too frequently or constipation too frequently? And along with this, most importantly, the time from which patient is experiencing these symptoms, but there's no change or the basic routine investigations are all normal, then I will think about IBS.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
Yes, this is very important. There are certain red flag signs for these patients. Somebody with unexplained weight loss, if there's blood in stool, or there's low hemoglobin or recurrent fever. Somebody who presents with these symptoms which mimic like IBS symptoms but which are progressing very rapidly, especially in a person who's more than 50 years of age. Somebody who has a strong family history of malignancy or cancer presenting with sudden change in the bowel habit. These are the red flag signs. I will definitely try to rule out other serious conditions before labeling such patients with irritable bowel syndrome.
How often do you see IBS overlapping with anxiety or depression, and how do you address it?
Yes, so this is very common. There's a significant overlap between all these disorders and IBS to the tune that the risk of developing IBS doubles in these patients. There's actually a cycle. So somebody with emotional stress is at a higher risk of developing IBS. Somebody with IBS can increase to or is more prone to getting all these symptoms and all these disorders of anxiety, stress, and depression. So there can be a loss at the individual level. The person is little reluctant to leave the house because every time he has got his loose stool, so he wants to be around his house using his own washroom. Sometimes there's loss of work, loss of income. The healthcare cost also increases in these patients because there are frequent visits to the hospitals, lot of investigations, lot of medications. Then the burden to the family increases because of all this increased cost, and a burden to the society also increases because of all this. There are studies done from India which says that the cost of an IBS patient can go up to rupees 70,000 per year. So this is very, very important. and there's a significant overlap between these two disorders. So it is a smart way to tackle both together to get good management of IBS.
What is management of IBS?
So IBS treatment is highly individualized. It's not about one size fits all. There's no definite drug pill for IBS. For IBS, first and foremost important is educate your patient, reassure them that you will be fine, explain them what exactly is their disease. After this comes the importance of proper balanced diet, good hydration, exercise. Ask them to manage their stress, and I personally prefer to start pharmacotherapy only if the symptoms are interfering with their life. My objective of treating such patients is to give least possible effective dose of the medication for the least possible duration of time. There are many societies which prescribe giving treatment for these patients for 4 weeks, for 3 months, for 6 months, and so on. But best way to manage these patients is non-pharmacological and pharmacotherapy only when required.
What advice do you give to patients for long-term gut health and relapse prevention?
So I urge everyone, for the prevention of IBS or better management of the disease, try to listen to your gut. Try to identify what are your allergens, what triggers your symptoms of IBS. Try to make a diary of it if possible. Discuss with your treating doctor. That will help you. Maintain a good regular diet, a healthy lifestyle, regular sleep pattern. Try to include some sort of exercise in your life. Try to balance and manage your stress. These are the key ways to manage and prevent your IBS.
How can physicians and gastroenterologists collaborate better for early IBS diagnosis?
Best way for a good management is a very good communication and open communication between the doctor and the patient. The patient should not hide anything from the treating doctor. He should be honest and really transparent with the doctor. I would re-emphasize that try to maintain a diary of your food, your symptoms. This will give a very good clue to your treating gastroenterologist. Second and most important, regular follow-up with your doctor. It is not a one-time fixed problem. So regular follow-up with the doctor will give you good management strategies.
One word that describes a typical IBS patient journey?
So one word, I will say understanding. So first, from the patient side, the patient should understand what triggers his symptoms. He should understand to explain and make the doctor understand what exactly is his problem. From the doctor's side, the doctor should exactly understand what the patient wants, what is he suffering from. And he should be able to make understand the patient what exactly is IBS. He should be able to educate him well. He should reassure the patient. So I think one word is understanding. Thank you so much for your patient hearing. Thank you.
Thank you, doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.